Okay, so I am so excited today and honoured to be joined by Annette Said as we talk about adrenaline dominance. So,
Mm,
Annette served as the CEO and is now the owner of Platt Wellness, who has
mhm,
taken forward the pioneering work of Dr. Michael Platt. So,
right,
Annette's journey, her path began with her own personal hormonal health and personal
yeah,
experience anxiety, fatigue, challenges of the midlife that so many of us
right,
experience, and you search
right,
for answers and just weren't finding them through the conventional approaches. So
right,
now you worked alongside Dr. Platt to promote his book Adrenaline Dominance and
right.
other books that he has, and his physician formulated creams, progesterone creams, and you found the
Mhm.
results to be life changing. And
Yeah,
as a result, you have now come to take over his clinic and his work. So I'm so excited to have you here today because I
great.
have got tons of questions and I know
Yes,
that my
let's get
community
on
will
with
have.
it. Yes,
So
definitely.
let's
Thank you.
start going through this. So, what drew you personally to the work of
Mhm.
Dr. Platt?
Well, I really feel it was meant to be. It was symbiotic the way we met because I was really applying for a position to help them grow their business and kind of get involved more in the operational and techie side. And, Dr. Platt and his wife retired. They moved their business to online. So it was a little bit out of their purview. They gave me a sample of cream and progesterone cream, and I was like, okay, well, I tried hormone balancing the other way. you know um well, quite honestly, I think it was more from Chinese medicine, and I just kept hitting my head against the wall, and I didn't really have a huge understanding, and I abandoned it. And I took home the progesterone cream, and as soon as I put it on my arms, like within minutes, I felt a sense of joy. It was amazing. And I mean, it was that because I was probably so deficient in it that it was, I mean, now I put it on, I don't feel that super rise because
Yeah,
I'm more balanced. But
yeah,
I was like, wow, it just, it resonated with me. And I said, there's something to this. And I really, as a marketer and an entrepreneur, I was really, I dove into his work. I dove into the books to really understand how to help get the word out. And the more and more I read about him, these books were written in 2014, but he was even way ahead of his time back then. And
way ahead.
right. And so you hear a lot about metabolic health, sugar, glucose, how it affects your brain. And, there's many, many very famous people writing books, Dr. Mark Hyman, Dr. Pearl Mutter, they're all talking about how your diet and your stress affects your brain. But from Dr. Platt's, when he was writing the book, he was really looking at it from the standpoint of hormone balancing because that was the business he was in. So he in treating perimenopause and menopausal women, which was his primary um, you know patient list. He also treated men as well. He found out that the 5% progesterone cream that he was using, not at 20%, not at 2%, it has to be 50 milligrams. And he realized that it not only stimulated the GABA receptors and created a sense of calm, and reduced, it started fixing the adrenals and the cortisol levels, and everything is a domino effect. And, there are millions of progesterone hormone receptors in the brain, more than any other organ or tissue in our body. And, you know, second is your uterus and ovaries, and what have you. But with progesterone receptors in your brain, it reaches such a broad spectrum. And so he's from an observational um, study, you might say, from treating his patients, which is how penicillin was created, by the way, not clinical studies. So observational medicine, especially in hormone therapy at that time when there were only studies that were studying, pharmaceutical companies were backing for synthetic hormones. So no one really had, it's like trying to patent guacamole. You can't patent natural uh, progesterone. So, so from that standpoint, really the only research was 4 decades of treating patients. And what he realized is that the progesterone was not only blocking estrogen, but it was also blocking adrenaline and therefore insulin. And then all these symptoms in his patients started to disappear. People with ADHD started to have more focus. RLS, restless leg syndrome, which by the way, my husband has and uses the cream, and it within
Mine
15
too.
seconds, it's
Yeah, mine too now.
up behind your knees. Fibromyalgia, and all this also, he had a team of nutritionists, so they developed a meal plan to help regulate, your glucose levels. So we found that it was best to dose with progesterone 1 to 3 minutes before meals, because if the progesterone is blocking insulin and adrenaline is a precursor to insulin, you're going to be blocking your body's response to raising insulin when it needs it. So what you want to do is you want to fuel your body with the glucose and ketones, which they have now studied to find out that the best source of ketones is from MCT coconut oil, which is kind of like the virgin oil of coconut oil. And so 2.5 tablespoons a day. But anyway, we have a meal plan. So over time, he has perfected a meal plan and other supplements. Now, with the ADHD sector, there are other supplements for the brain he also recommends, which are in his book, to support, depending on where you are on the spectrum of ADHD. And I don't want to say spectrum in terms of, but it is an attention
The
focus.
type of traits that you've got coming up as to
Right,
what could be best supported.
right. And just so you know, I have a letter from a woman who has a child that is autistic. And this was many years ago, but because of progesterone and its therapeutic uses in even brain trauma and et cetera, and his use and attention, he said, try this. Progesterone is so safe even for children. And, when you think about how much progesterone is in the womb, it really is safe. So she did it. She said, for the first time, Dr. Platt, my child has started to speak.
Doesn't he speak about this in his book? Because
Think
I
about
think
that.
this, and I was
Yeah, I
just like,
think he
that is
did mention
incredible.
it. Yeah, yeah, I
Yeah.
do believe he did mention it. Yeah, I have to go back and listen to it again and again. But we have actual letters and testimonials of that. So
Mm,
that's a huge, yeah.
powerful stuff.
But anyway,
Um,
so that's how I met him. That this is how he started when he wrote his Miracle of Bioidentical Hormones book. And through his practice and observational treatments, he was encouraged to write the Adrenal Dominance book. And really, when you think about how ahead of his time was, he framed it from the bioidentical standpoint. um, Perlmutter and Hyman, they talk about diet and sugar and whatnot, and that is a huge piece. But if you're really looking at someone who has chronic attention, disorders, progesterone is, the diet and the progesterone treatments are really key in terms of really getting well. And so I think there's so many different pieces. Our bodies have, hormones run every system in your body. Adrenaline is hormone, so, and insulin. So
and I think
they
that
all.
might be really, it might be a really good place to look at is to kind of go back a bit and talk about his book, Adrenaline Dominance.
Mhm.
What is adrenaline dominance? What was he talking about with that being?
Yeah, so that kind of goes in hand with adrenal fatigue. Now, it's really just the short answer to that is he believes that adrenaline dominance is adrenaline fatigue. It's just a mischaracterization. The reason that he is calling it adrenaline dominance, well, he came up with that term because of estrogen dominance,
Yeah.
and he just kind of called it adrenaline dominance. But really, the pivotal moment of him realizing is that the difference between uh, Dr. Platt and other endocrinologists or anyone else in, that have medical degrees to treat hormones, is that most integrated practitioners use saliva tests.
Mm.
And saliva tests, he feels, typically are the wrong way to go. He suggests blood tests. And the reason why is that if you've ever spoken in front of a crowd or have gotten nervous and your mouth gets dry, so adrenaline, and this is proven, adrenaline restricts your saliva because it's not a necessary function in a flight or fight.
Mm,
So when you're in a flight or fight, everything starts shutting down except what really needs to function. And
mm,
saliva is not one of them. So if you
mm.
have high adrenaline and you're doing a saliva test, the test is going to come out low cortisol. And then what do the
And
doctors do? They give you something to stimulate. They give you a stimulant, which
yeah.
is completely wrong. So he said, so that's the difference between how um, different between him and other healthcare practitioners is he said what's happening is adrenal, when your cortisol levels are not low, they're high. And when you have constant adrenaline, your cortisol levels, that's your stress hormone, it comes in like a big brother and says, calms you down. So, um, so really and I've had this done before. I've had saliva tests with when I had adrenaline dominance and and they gave me a supplement and it wired me out. I thought it was gonna, burn a hole, drill a hole in the ceiling. And so that is the difference between that. So that's why he calls it adrenaline. It's really adrenaline fatigue is adrenaline dominance in his mind.
So would he then be saying adrenaline dominance is the same as what we call HPA axis dysfunction? Are they the
Um,
same?
yeah, I suppose so. Yeah.
Yeah. Okay.
Yeah.
So how does adrenaline dominance, if at all, differ
Mhm.
from high cortisol? So we've got, just for anyone who doesn't know, we've got adrenaline and cortisol are both stress hormones. Adrenaline is
Mhm.
like the one that kicks in instantly, get you up, get you going, and the cortisol
That's
is
your
what
flight or
comes in
fight.
behind. Yeah, the cortisol is like what comes behind to kind of keep the stress going, right? For
Correct.
that survival thing. And
Right.
I call cortisol like the queen bee hormone within
Right.
the model I use in clinic, because if cortisol is out of whack, the whole system is going to be struggling, particularly when we're
Right.
looking at progesterone and that relationship. So does it
Mhm.
differ from
Mhm.
having high cortisol or like this general chronic stress, or are they kind of all in it together? It's the same thing.
I'm sorry, can you rephrase that question?
Sorry. So how does it differ from high cortisol? Is adrenaline dominance the same as high cortisol?
Well, it depends on what stage you're in. Like for instance, if you have chronic stress and high adrenaline and cortisol level is high, trying to manage that,
Mm,
eventually cortisol levels will start to not function as well. They're going to be taxed. So then you get into stage 3 adrenal support. You're going
mm,
to need um, a little bit more support than progesterone. And
mm,
there are some supplements that help with adrenal support. But so, in essence, if you are really, really far down and you have high adrenaline, you have no way of managing it because your cortisol levels are just not functioning like they should because they've been taxed for so long, you're going to have low cortisol levels.
mm.
So one of the ways to at home, you can do this with a blood pressure, is if you feel that nothing that you're doing is helping your adrenaline levels and you may need some additional support for your adrenals, just to get like a targeted supplement for 3 or 4 months. We just introduced a product a couple months ago called Adrenal Reboot, which actually I tested because I went through this. I was
We've all been through it at
helping my
some
mom.
season.
Yeah, I had chronic fatigue, and then all of a sudden I was getting hypoglycemic issues, and because cortisol also manages your insulin and your
Yeah.
glucose. So I started piecing it together and it dawned on me. And I had a year and a half of um, helping my mom fight cancer last year. So I was like her sole caretaker, and that really it just burned me out.
Mm.
And so I thought I need help. So I what happened is through another hormone coach that I is well regarded, that is a colleague of Dr. Platt's, and I was speaking to her, and she says, when you lie down, take your blood pressure, and immediately stand up and take it again. If it's lower standing up than it was when you were lying down, that means your adrenals need support.
And that's really interesting. So needing support in terms of they're getting tired or
Your
they're just
adrenals need some supplements. They need some support.
right.
Yeah.
Okay.
So,
So
and that within 3 months of me taking Adrenal Reboot for twice a day, within 5 days, I started to feel like I can get out of bed.
what does that contain? Is that like adaptogenics or specific vitamins and
There are,
minerals?
well, this one in particular, so there are stage 1 and stage 2, stage 3. So adaptogens do well when you're not really, really bad. And so there are some adaptogens that work really well. I have Hashimoto's, so I don't do too well on ashwagandha, but it was more of like a bovine support and other adaptogens along with it. So I found an adaptogen that didn't have ashwagandha. So I would take that in the morning because your cortisol levels are really high in the morning. It's just kind of it's your nature's way of you waking up and getting energy for the
Getting
day,
going. Yeah.
and it spikes again around 2:30,
Mm,
3 o'clock in the morning.
mm.
So I would take an adaptogen and it would just kind of calm me down. And I would eat within an hour because I had to
Yeah,
get
always.
sugar levels start because cortisol wasn't managing it. So I had to implement the diet. I had to eat some protein within an hour, even if it was just a boiled egg or pieces of cheese or whatever, And then I would take the bovine around 10, anytime between 10 and 2.
And for anyone who doesn't know, bovine is the hormone. It's
Pig.
basically like HRT, right? But it's come from the
Well,
animals and put into
bovine
a
is
supplement.
from a pig. Yeah, yeah.
Yeah, so it's come from
And
an animal into a
right,
supplement to kind of supplement the cortisol to help
right, right,
replenish that. So
right.
what you're speaking about there, Annette, is talking about different levels. Could you explain level 1, level 2, level 3, and what the
Well,
differences are?
I can't really go dive in too deep into that, but I know that level 1 is an adaptogen, and I jumped from stage 1 to stage 3. And so I think stage 2 is really like more of the bovine support, but not as much. So depending on your healthcare practitioner, how they might help
Okay.
you, they might say take an adaptogen in the morning and one at night, and or two, you know, bovines in the morning and the afternoon, or some people take two and two. It really depends.
So the levels you're referring to are the supplement protocol
Right.
rather than levels of adrenal dominance. Okay, cool. So
Yeah.
if someone hasn't got access to testing, how might the it show up? What are the common physical and emotional symptoms? So I know that he refers to conditions like you said, like PMDD, IBS, fibromyalgia,
Yeah.
ADHD, this kind of thing, like these really specific
Right.
conditions. But what
Mhm.
other kind of symptoms might someone be looking at if they're
Well,
adrenaline dominant?
wired but tired,
Mm.
feeling overwhelmed, um, and mood, sleep disruption, waking up in the middle of the night, urinating, um, tossing and turning, irritable, um, and there's so many other symptoms like grinding your teeth at night, RLS,
Mm.
um, fibromyalgia because you're tense. I mean, there's two different types of fibromyalgia. If it's stemmed from too much stress, that will definitely help
Mm.
with that. And I know that in children, it would look like bedwetting. It would
Mm.
look, even infants would have colic. And
Mm.
mothers really, it's hereditary. So if the mother has, high adrenaline, she's going to pass that on to their child. And so that's
I
what it
can
looks like. Even
absolutely see that in myself. Yeah.
Right, right, exactly.
Mm.
So, and hyperglycemic, I think, is the big one if your cortisol levels are really taxed. That is,
Mm.
then you're looking at stage 3, some other support. And, and I stopped taking progesterone during that targeted supplement time because it was
Mm.
blocked, because, progesterone blocks insulin. And I really needed to get on top of my meal plan and my glucose levels at that stage. So, and it really depends on the individual. And then I started incorporating the progesterone back into maybe after 2.5 months or so, but I continued with my supplements.
So could you explain? So Dr. Platt's protocol for adrenaline dominance is very clearly putting
Mhm,
50 mg, so a
mhm,
5% cream, on
mhm.
1 to 3 minutes
Right,
before your main meals, right? That's
right.
largely his fat, with a diet that's very focused on protein, veg, complex carbs. That's kind of the overall. He keeps it
Yeah,
really
you can
simple.
have some fruit, I
Yeah.
mean, I mean, you don't have to completely starve
No,
without
we're
fruit.
talking
I mean,
keto. We're not talking keto
we're not,
diets. I'm not a
we're
fan of
not
keto
talking
diets,
keto.
especially for women. But
Exactly.
what, so could you break down when that progesterone cream goes in? It's in every cell of your body and like 20 seconds. But what's it doing in relation to the insulin specifically?
Well, it does block insulin. And so basically, that's why he says, if you're going to do the progesterone, you should eat right away because your body is requesting sugar or glucose complex. And so if you're not eating and providing that, and then you're using progesterone, it's blocking your ability to raise your insulin levels. So your body's requesting sugar, you don't have it. And then adrenaline starts surging. And that's why some people start the progesterone if they have really, really high dominance, especially with ADHD. You're so creative. He says that it's really ADHD is not horrible. He had it, by the way. He said it's more of an interest issue than it is an attention issue.
Yeah,
I
if
mean,
we're
if you're
bored,
really
we're out.
interested,
Yeah. If
you're
we're
going to
interested,
focus.
we're for
Yeah.
hours and hours. And if it's really boring, we're out within
You're
seconds.
out,
The
you're
brain is
out. You're
beyond.
like, okay,
So,
next. But so
so
so that's the whole that's the way, the reason he has a meal plan and the reason that he suggests 1 to 3 minutes before meals is that you need to fuel your body with the right glucose. So you're mitigating the fact of um, raising insulin to raising adrenaline to raise insulin. So you're keeping your kind of level.
if somebody said, okay, but surely I need the insulin. Why do I want to block it working? If I'm
Well,
eating
I mean, it's
something,
not
I need
blocking
that
it,
insulin to get it into the
right?
cells. So what would we
It's
say there?
It's what, yeah, you do need insulin, but you don't need, it's like treating, if you were to say, it's really like a hypoglycemic diet,
Mm.
if you're looking at it
Sugar
from that
regulating,
standpoint,
right?
right?
Yeah, it's a blood sugar
Okay.
regulating diet, isn't it?
Right, exactly. This is what we're
Which is
really
actually,
focusing on.
and I think is ideal for ADHD people, because my
Right.
three pillars of working with ADHD is replenish progesterone, blood sugar regulation, nervous system support. They're the three pillars for perimenopausal women, particularly, that I see. And his whole protocol, when I saw it, I was like, oh my gosh, this is what
Right,
I've been doing. But he's got this real specific structure to it, which I quite liked. So
right.
it's like, okay, but what's the importance of eating? So one of the questions I have for some of my community was, because we forget to take it, ADHD blindness, that tube is there on the table where we eat and we just don't see it. So they then say, I forgot to do it beforehand. Is it still worth me taking it when I've realized halfway through the meal?
Yeah, I get that question a lot. Well, it's not going to help you regulate your blood sugars, but you will get benefit of the progesterone
That's what I've been
from a
saying. I was like,
hormonal standpoint,
yeah.
so it'll still attach to your receptors, but it's just not going to help you from the standpoint of helping regulate your sugar levels. So,
Okay.
yeah. And,
So,
I would suggest, like, we have travel sizes. I know it's really hard um, to think about that every time you eat. You go out to a restaurant, you may forget it, so that's why we introduce the travel sizes. You can put it in your bag, your purse, your briefcase. So
insane. Have it everywhere. Actually have one everywhere that you go and
But
have it
but
there.
keep in
So,
mind, I wouldn't listen, if you skip the progesterone, but you're eating the diet really is 90% of the program as well. The
mm,
progesterone's going to really help so many other issues, the calm, this is
mm,
going to help you get there faster. But if you forget your progesterone and you eat, it's not the end of the world. As long as you keep on that diet. So if I think the most important one he indicated was around lunch time.
yeah. So that's the one. If there's one that we're going to get in place, really
Right.
focus on getting that in, which is
Right.
interesting because usually for ADHD, that's the hardest because lunchtime can change depending on work and what we're doing. Whereas the morning
It
routine,
can.
now,
It can.
it's a bit tricky, but we get
It
there.
is.
consistency is not always our friend. So
Yeah.
from his perspective, where did adrenaline dominance come from? Why have I got adrenaline dominance? Is that
That's a good
genetic?
question. I really
A
don't know.
genetic a
I
genetic
think it's more,
predisposition?
it is genetic. I don't know. It might be nature's way of creating very creative people on our
Mm,
planet. I mean, when you look at the scientists and doctors and the arts, and people really are driven. They have this creativity energy. So I really don't have an answer to that. I think that you can look at it as a blessing, or you can look at it as a curse. Um,
mm.
I think for Dr. Platt, since he had ADHD, he's very smart and creative, and he realized that the people that he was treating that had this issue were very creative types. And
Mm.
so I think it's just, it's in your DNA. It's part of who you
And
are.
I really love how he speaks about ADHD. And when I look at the time, like you said, in which he was writing this book, it wasn't like it is now. I mean, it wasn't a huge amount of time ago, but it was
Right.
long enough in terms of this change around
He was
the narrative around
pioneering that. He
ADHD.
was really pioneering that. He
Yeah.
was.
And I suspect something that's going to come up, which he talks about in his book, but as we're having this conversation, is what men can use progesterone, children can use progesterone. And it's this
Yeah.
because it gets so much, it's discussions in women's spaces, right? So to
Yes.
me, just as testosterone is a human hormone,
Yes.
progesterone is a human hormone. But
Yeah.
one of the questions I get is, oh, is that okay to use on men and women?
Yeah.
And the other question is, can I do too much? So let's create a space to explore that. So first of all,
Oh,
should we
sure.
look at men and children? What's
Yeah.
the deal here with progesterone cream?
Yeah, we get that questions. We get a lot of emails from, women that have heard his book, read his book, will refer to him, and they have children that are ADHD, and they're like, how much can I use? How much and I said, I don't have a medical license. I can't give you dose information, but he has a section in his book on that. And his viewpoint, along with many other of in that circle of tribe, progesterone is very safe to use. And, you know, when you think about when you're in the womb, I mean, you have, you know, hundreds, if not
Well,
thousands of milligrams,
yeah.
and it's developing. And children that have good, and the mother who has a balanced progesterone usually have children that are stable and creative, and, because it helps develop the brain, as we had
Mm.
mentioned back, that there's
One
so
study
many
that actually
receptors.
shows There's one study that shows low progesterone in pregnant mothers is an increased risk of ADHD. Well, no wonder, right? If that progesterone,
And
and we know,
miscarriages and postpartum
yeah,
depression,
yeah,
and so many other things.
yeah.
Um, so, so back to your question is for men, we all have the same hormones. Men start declining. Now, progesterone starts declining sometimes even at 40, but mostly 50. I think men start declining, if I'm not correct, if I'm not misspoken, but I think around 40. I think women are
Yeah,
around 40, maybe men around 50. Now your
yeah.
body
So
stops producing levels of progesterone, but it never stops producing estrogen. And I
mm,
think that a lot of women who come to us and say, "Oh, my blood work says my estrogen is low, I'm going to need estrogen." Then they start the cream, and they start having these estrogen kickback symptoms because it's stored in their tissues and it's not showing up on the blood tests. And
mm,
I would say this very confidently: throw your estrogen blood tests away. They don't give you an accurate reading. They're a snapshot in time. You need to get a blood test, maybe in the
five
beginning of
minutes.
perimenopause, where you get
Mm.
a baseline and you have to do it within 12 hours of or 13 hours of applying if you're on hormone therapy. And, it's ideally to do it before you even start hormone therapy, because you never stop producing estrogen, even when you start having ovarian failure, because you're making it through your adrenals. Adrenals
Mm.
actually rely on progesterone, and cortisol as well rely on progesterone. So if you're
Absolutely.
stressed, you're depleting the reserve of progesterone, and that's how that helps. So
And this is,
men
I say,
experience that also.
I say quite strongly that perimenopause is an adrenal function issue. It's not your ovaries. It's that there just is not the progesterone in the tank and that production, because the adrenals are so depleted to be able,
Right.
and they will prioritize your stress hormones, right? And I watched a webinar
Oh,
recently with Carol Peterson, and she said for
yeah.
men, they've stopped producing progesterone by the age of 50. So we
Yeah,
start
that's what it is.
seeing
Right.
that
Hmm.
weight around the tummy coming in,
Exactly.
right? Which is where we're talking about this relationship with progesterone and insulin. And the
Yes.
men I've been trying this protocol on, it's really interesting. That
Yes.
weight is moving around the tummy. They're
Yes.
sleeping really well at night. The restless legs
Yes.
have stopped. The mood is more
Exactly.
regulated. And I'm like,
Yeah.
wow,
Yes.
and I always come back to this conversation. Why isn't this frontline medical practice? And I know, and it's not a patentable product,
Well,
right?
it's improving. Even just in the last couple of years, I've seen so many people, um, realize that the clinical studies that were in the 80s were faulted by the Women's Health Initiative. This study was based on 65-year-olds. They were already postmenopause, and they were saying, and they were using synthetic hormones and mostly estrogen, and
There's
then
risk and there
progesterone
is side
later.
effect. Yeah.
And so it sent out a ripple in the whole community worldwide that hormones, synthetic hormones that they were using and basing the studies on, were causing heart issues and osteoporosis when these women were 65. They should have started it when they were in their 40s or
And I
50s.
think what's, just while
So,
we touch on that, is something that I still hear prescribers telling women, oh, progesterone causes breast cancer. Utter nonsense.
how,
We have
I don't.
multiple studies showing progesterone protects breast health. It's synthetic progestins that
Right,
they call progesterone, to add to the confusion, that links with breast cancer. It's not progesterone. So
right,
if that's a fear that a woman has listening to this, like, oh, but what about that? It's not. What we see is if you take too much progesterone, which you would need a hell of a lot of being slathering yourself in it repeatedly,
yeah,
you will get tired, and that's the edge. And it's interesting what you were saying about estrogen dominance, not estrogen dominance, estrogen kickback. These are the parameters
mhm,
I tend to give my women. Is if
mhm.
you'll know your edge of too much, because you might get that like fuzzy head and your eyes feel a bit tired, that in a few hours is going to clear,
Yeah.
right? But the
Okay. So,
other end
yeah.
is taking too little, and you're going to see your mood possibly change, right? Becoming a bit
Right,
low. And usually in that situation, it's the estrogen kickback. And what we see is higher doses faster tends to deal with that,
right.
right? So I have a whole webinar on that. But
Exactly.
is that
Yeah.
what you see clinically as well?
I don't want to use the word clinically. So
Yeah.
really it's
Or in
about
your community?
let's go back to the blood tests. Blood
Yeah.
test doesn't really give you the accurate information, but there's urine and there's Dutch and whatnot. And so you can do several different tests to paint a picture. But as Carol Peterson said, along with, on her radio show with Corrine, um, they it's about your feeling of, the goal is your feeling of resistance, of resilience. I'm sorry, not resistance, resilience. The goal is to get the feeling of resilience. Now, if you have, if you're going through perimenopause and you have ADHD, you have to really pay attention to your symptoms. When you had mentioned what's too much or what is too little, the beauty of the creams and the hormone, progesterone that goes into your system along with a diet plan. Now, now we have symptoms as considerations. If you start it and you have estrogen dominance and you don't know it because you're going off a blood test, very likely, what happens is when you start the cream, you're going to have estrogen kickback issues, and I can include a blog in this
That
interview
would be
so you can
great,
share
please.
it.
And I'll put that on my
And
website to be downloaded as a resource.
absolutely. But
Yeah.
basically, the progesterone, the reason you're having kickback issues is because the estrogen is stored in your tissues. And what it's done, what the progesterone does is it goes in and it knocks out the estrogen. So now the estrogen is in your blood system again. So you're experiencing estrogen dominance where you might start feeling headachy and achy, or, everybody's different, but you're going to have some of those issues about that. Stay the course. It'll probably, you might have maybe some soreness in your breasts. It'll last for a few weeks. Now, what is really important is to make sure your liver detox pathways are clean. So if you're having gut issues and you start this and you don't know your estrogen dominance, you're going to not feel so great for the first few weeks, but it's pointing, the important thing, it's not a bad thing. It is pointing you to symptoms that you need to address. You need to detox the estrogen. There's several ways to go about it. You can either take a supplement for like DIM, make sure you have CDG in it so it assists the liver for the best way for detoxing. Really will help you not have such horrible detox symptoms. There's also Ray Peat. I don't know if you know who he is. He's one of the original pioneers, but you know, there's a lot of his teachings are still good, but we've progressed. He has a carrot salad recipe, which will also be in that estrogen kickback article I gave you.
Yeah.
And the
Brilliant.
carrot salad with MCT oil and apple cider vinegar or olive oil. You can make a little salad dressing, which I do, and you shred carrots. It helps pull the estrogen out of your gut.
So simple, but so
So
effective,
simple,
right?
so
Because a grated
simple.
carrot, yes, it's
Yes.
really effective.
Yes. And so anyway, I've been taking a supplement with DIM because I want to we carry it, and so I've been doing it, and I do notice that there are I've been detoxing, and so it's been good, and so
You obviously want to use that
that's
long
one
term, right?
aspect of it. So if you are
Yeah.
having those symptoms, you need to make sure that you assist your body with detoxing, but also you can titrate up the progesterone dose to oppose estrogen. Now, Carol Peterson, on one of her podcasts about women who bleed, who have endometriosis from too much estrogen, whether it's from taking birth control pills or they just naturally have it, and their endometrial lining is thick, and progesterone helps shed that and heal it when you're going through your regular menstrual cycle, whether you're going through perimenopause or not. So she has some women up on 1,700 milligrams a day,
My
just
dose
just to
is
get
1,200. Yeah, that's what I take,
right,
a variety of different types of progesterone, and I
right,
take anywhere between 1,200 a day and 1,800 a day.
exactly, right,
And so I have my baseline of vaginal and oral, but where I have more control and can be really empowered is through the cream and
correct,
dosing in that way.
right. And I know there are some quite a few women that come to us and they really like the oral. I think where you are, we call it permetrium, but I think you have, what is the brand name?
Progestan
Yeah,
generally, yeah, but it's
right.
micronized
Correct.
oral
And they
progesterone.
like it because it makes them sleepy, but quite frankly, I think that you have to take into consideration the loss of it going through the liver. So you're losing about 80% efficacy of the oral, but some people like it. I just
Yeah,
kind of meet people where they're at, where they feel
yeah.
comfortable. And the
I'm
cream,
just
a
in
lot, they
here.
want the cream to supplement during the day
Yeah.
because they can't take the oral during the day because it makes them sleepy.
And I think this is a really important
Yeah.
point, that Dr. Platt's protocol is very specifically about the cream. Okay, so
Yeah.
if someone says, "Oh, I'm going to just take my oral one before
Yeah.
these times," no, it's not going to work in the same way. With
Yeah.
progesterone, the way that it's delivered into the body is
Right.
really important, and that impact of how you're going to experience it. So the model here for this is very much about the cream. It's not about other forms.
Yes.
Not that you can't have other
Yes.
forms with it if that's what you're doing
I
for
would say
different things with it.
transdermal. Yeah, we just launched an oil. I really particularly love it. It has vitamin E and MCT oil and USP progesterone. I absolutely love it. Our creams have been amazing. But yeah, it does go into your skin within minutes. Um, and I will tell you this about, we had a client, and I have to tell you, disclose that she's a cousin of mine. And we had reconnected after many years, and she's a little bit older than I am. And she said, I just started, and I told her what was happening with my company. And she said, I just started. I went to a lady doctor, she said, and put her on permethrin, which is oral, and a patch, which was, I think they were all bioidentical. However, she was having hot flashes like crazy.
Mm.
And I said, well, why did she give you a patch? And she said, I can't remember, maybe her blood test was low or whatnot. Anyway, she said, you know, I started taking it and it just, I mean, she would wake up in the middle of the night drenched. She would have to take a shower. I mean, she was fully wet. And I said, you know, I said, I told her about the oral. Maybe she's not taking enough for it to work. And I said, I don't really understand, you know, I haven't read your blood test, but I would assume at your age, based on her weight and the way she looked kind of bloaty, you know. And I said, why don't you take this cream and just try it? You know, and if you don't like it, you can go back on your medication. And you know, I had a little bit of liberty because she was a cousin of mine, so I wasn't in terms of telling her how to apply it and whatnot.
Mm.
And so I said, you know, try to do it in the morning at night because I know that, you know, she didn't have adrenaline issues or anything. But within 2 weeks, she stopped having hot flashes.
Mm.
And so
Wonderful.
from moving
Yeah.
from the oral to that, because, and I really feel that she wasn't getting enough because it was
Mm.
going through her liver. And so if she was taking 100 or 200 milligrams, that was like, you know, you're talking about 80% less going through the liver.
Because it's all
So,
becoming allopregnanolone, right? Which is, as you say, lovely for sleep, not so good for progesterone levels.
right.
So, if someone starts this protocol, how quickly might they start to see results?
Oh, within 24 hours.
Mm.
And
Yeah.
how was that your experience when you started?
Absolutely. I mean, I've got everyone I know doing this protocol at the moment because I'm like seeing it in action,
Yeah,
and people are loving it. They're not getting the energy afternoon crashes. Side effect that women are
right,
losing weight around their tummy. You know, their mood is feeling better. They're not getting
right.
cravings. It's
Yeah,
very, very quick. And I know that in his book, he says if you're not getting a response to it quite quickly, adrenaline dominance isn't your issue, right?
right.
It's when he was talking about my interpretation, and correct me if this is wrong,
Mhm.
was this is how to know, is it where your adrenals are just exhausted and you've got severe HPA axis dysfunction, or is it adrenaline dominance? And
Mhm.
the HPA axis dysfunction is going to take a very long time to get better, probably around 18 months. Where with adrenaline dominance, you're going to get
Right,
that cream in and you're going to know quite quickly. So that's like the easier way to test,
right.
right? Because they can look similar and they can both coexist. You know, we can have that flatline exhausted
So,
adrenals plus still
right.
be pumping.
Tell me some of the symptoms for somebody with APX access. Tell me some of the symptoms that
So
happen.
usually if they're chronic, it tends to show up like fatigue. You
Mm-hmm.
know, it tends to show up as that's the biggest one. You know, they wake up, they feel like they're staple gun to the bed. It's like wading through treacle, getting things done. They can end up tired but wired in the evening. Whereas
Mm-hmm.
my understanding is with the adrenaline dominance, there's more of a bit of firing, if you want, and then eventually that
Mm-hmm.
firing kind of crashes.
I mean, doesn't that have something to do with your cortisol levels also?
Absolutely, yeah, it's cortisol. Yeah,
Right,
absolutely. That's how it's tested, is through
right,
cortisol.
right. So, and yeah, I wanted to move to another topic called type 3 diabetes, which is it's not really a clinical official clinical term, but the Mayo Clinic does have a study on what they call type 3 diabetes, and it's insulin resistance of the brain. And that is a precursor to Alzheimer's and dementia. And that is what we call something that when I told you I was in stage 3 adrenal failure, because I really needed some support. It's even beyond that. It's someone who has developed insulin resistance. And type 3 diabetes is basically insulin resistance in the brain. And if you're that far, then he does recommend pausing um, dosing the progesterone cream for a few months and getting back on a diet, like a metabolic diet, and really supporting your brain, your metabolic health with some of the supplements that he mentions in his book. And really, really focus on your diet and then resume again. And I think
Why is
that,
that?
hmm,
Sorry, why did he say to stop the progesterone if that's the case?
because you're going to have side effects from the progesterone because you are insulin resistant and you're using progesterone and it's blocking insulin. So you're
More.
creating a vicious cycle. It might come out where you have heart rate, you're anxious, you feel like maybe some people have even gone to the ER, the hospital, because they feel like they're going to have a heart attack or a panic
Mm.
attack. I mean, it's pretty extreme. And if you're
Mm.
having something like that, where you don't realize you do have insulin resistance, that's how it's going to come out when you use the progesterone. So he says
Somebody has,
pause.
if
Mhm.
any, so if anyone, whether it's that extreme case, if someone has insulin resistance, they shouldn't be looking at progesterone cream.
Yeah, you need to pause it for a little while until you get
Diet,
back
right?
on track with a diet and supporting and get your blood sugar levels balanced again. And diet, like I said, was really key for that.
But
And
that
then,
real,
yeah,
yeah, that real blood sugar regulating is the priority. And
it is.
if you start noticing like hypos, that's what we're looking at there, isn't it? Is that
Exactly.
you're getting a drop, you're getting that hypo drop, and
Right.
that's giving you symptoms. If you start noticing that, that's your body saying to you, there's an underlying blood sugar issue here
Right.
that needs to be addressed.
Right. It's not the cream, it's just your symptoms are exemplifying, a pretty extreme insulin resistant
Yeah.
response.
But I think progesterone is generally really good at this. It's the same if you start
Absolutely.
taking progesterone. If there's an underlying candida issue, you're going to know about it. It's not because the progesterone's caused candida.
Right.
It was there, but it's going to show you it's there. So
Correct.
that's what I love about it. And it's so we need to be clear. It's not the progesterone cream. It's there's already an issue
Right.
that she's making you aware is there.
Well, this is something that comes from Dr. Platt. He said it's better to prevent than it is to correct. So
Yeah.
if you want to start on if you're going down that path, it's really good to start on this protocol when you're in, especially, well, if you're ADHD, you don't have any age range, but especially when you're going through perimenopause and you stop producing progesterone, you're going to need that supplementation. So,
And just one final question on that. Which is another question that comes up for me, is we know that 200 mg of progesterone will stop ovulation, right? So women in that follicular phase actually would, this is below that. His protocol is below that 200. So we would think it's not going to affect ovulation. But would he suggest that women use the cream throughout the cycle or more focused in the luteal phase?
well, you can cycle it if you want to conceive and have children, but they're really in his mind. He doesn't feel if you don't want to have children, then take it every day. It's going to suppress your period,
Mm.
which most people, well, most women, welcome that.
Mhm.
But there isn't any benefit to cycle. It's not going to keep you younger or more youthful. It's just going to suppress your period. Um,
Interesting, because we don't tend to see the suppression at that level. When we start going up
Mhm.
to maybe like 300, 400 in
Okay.
that transfer, then that's where we
Right.
tend to see it. Obviously, everyone's so bio unique
Uh,
and that
Right.
sensitivity. But it
Right.
was just,
When I say suppress, I don't mean stop completely.
no, just make gentler, make
Yes.
bearable. So there's not being led by estrogen, right? If women are suffering that way. This has
Right.
been so useful to have this conversation with you.
Yes. Thank you. As
Going,
me as well.
going forward, how
Hmm.
do you see his work, the legacy of his work going forward now?
Well, through education and outreach and podcasts just like this is,
Mm.
really diving into verticals. Like, he has two books and he has two approaches. I mean, he's about hormone balancing and optimal health and supporting your system based on where you are at. So whether you are going through perimenopause or menopause, or you just or you have symptoms that are related to adrenal dominance, whether it's ADHD or fibromyalgia. Um, it's really about getting the word out and touching people through success stories and through podcasts and outreach. He was so ahead of his time that it's really relevant now to what people are experiencing, especially the chronic stress that we're having on a daily basis. And,
Completely untenable,
you know,
not normal.
I would
Usually
probably,
mismatched.
I would really suffice to say, and I would feel comfortable saying this, that most everyone is probably dominant in adrenaline at this point. And
Mm.
that's a healthcare crisis.
Yeah.
You know,
Absolutely.
when you're stuck in flight or fight almost on a daily basis and you're not, and your body isn't able to heal, you know, you're going to start getting those symptoms that it's like a domino effect. You know, your blood
Mm,
sugar, insulin resistance, dementia, Alzheimer. I mean, why do you think Alzheimer and dementia are so high?
mm,
Because we're
absolutely.
workaholics, you know, we don't stop. And not to
Mm,
mention world events and where we are. So really, you know, I love the fact that so many people are health biohackers and are reaching out on social media and podcasts and shows, because quite frankly, it shows that the medical community has failed us. They have
mm,
missed the boat. And here in
mm.
the US, in order for a doctor to get a degree, all they have to take is 1 week of hormones class. 1 week.
A week is a lot. I think we get like 2 hours here in our training. It's
Right.
crazy. And we've
So,
owned the UK, the NHS has said they're a misogynistic medical system. They don't understand our bodies. And this
right.
is where practitioners like myself and even your own journey, we're pulling together these bits of information that we come along that for some women can be game changers.
Well,
So
when they go to their doctor and they don't get results, and then their doctor says, well, maybe you should get on an antidepressant because that's their go-to because they can't figure it out.
anything
And so
else?
then they stop, and then everybody starts going to Facebook groups or join organizations or listen to podcasts, and you have to take control of your health. And
Yeah.
so I think, you know, that is what we're going to continue to do is get that information out
Mm,
and as much as we can. And I, you know, really appreciate you having me on this. I'm
mm,
thrilled to be able to help your group and other groups. And I just
yeah.
wanted to talk about one more subject, women without a womb.
Yes.
Okay. So,
Being denied progesterone.
and if I just don't understand that. I would say, and Carol Peterson can corroborate, you may have had a discussion with her. She has quite a few interviews and podcasts on her website. However, it's estrogen, women, I would say our statistics are about 46% of women that are um, perimenopause and above have had a hysterectomy because they're bleeding and their doctor tells them they can't get it to stop, or they put them on synthetic estrogen birth control
Mm,
pills, which may help 50% of women or not, but it's in the long run, it doesn't.
mm.
And when they could have just increased their levels of progesterone and stopped the
All
bleeding.
the time. In clinic, we see it all the time. Women coming in, I'm being
Yes,
told I've got to have a hysterectomy. When we get the progesterone right, usually within 2 cycles, they're having normal periods and they're angry and
exactly.
righteously
Right,
so. Because they were going
right.
to whip out their womb. Like, what? This is estrogen dominance and a medical community that
It's just
refuses to acknowledge estrogen
right.
dominance.
Yes. And you know, really estrogen, you know, when you talk about when you have ADHD and you have this creative brain, you are depleting, you're working, you're using a lot of
Mm,
progesterone. Like I said, there's millions of receptors in your brain. And you know, estrogen relies on cortisol too. So it really is all your hormones need to be balanced. And but I just wanted to point that out because I'm sure there are people in your community that have been directed to have a hysterectomy. And once you do, especially if you take out your ovaries, you know, your ovaries, and they're finding more and more studies that show it really it modulates your mood and so I mean you go into a depression and so it was really important to be able to spread that message out as well. That
yeah.
I point people to Carolyn for a deeper dive if women come with bleeding, because you really do need to get an ultrasound and rule out cancer. But
Mm.
once you do that, it means that you have a thickening of the endometrial lining, and you
Which
just
is driven by estrogen
you
and
need
not
to
enough
shed it.
progesterone.
Correct,
Exactly.
correct. Yeah.
So
So.
For anyone who's I really love that, because I think all of us are trying to push against this narrative that women who've had a hysterectomy don't need
Right.
progesterone. You are doing them such a disservice because of all these amazing things progesterone does: protecting your breast health, growing your bones, for supporting your nerves in the
Correct.
myelin sheath. Why would you deny women that just because they don't have a
Right.
womb? As you can tell, I get very passionate about that.
Yes, yes,
So
exactly. Good.
just to bring this to a close, if women want to get the cream, how can they do
Mhm.
that, Annette?
Yes, so if you're interested in our cream, you can visit Platt Wellness, Platt wellness.com. And because we're on this podcast, you can use a 20% off a promo code called Adele, ADELE 20, and that'll give you 20% off on our creams and our books. We do have other supplements, but the promo code is really just for the creams and the books. And
Amazing.
so we have some bundles. We also introduced an oil, like I said, so that does include
Mm.
that as well. I find we sold out in one weekend when we launched it a few weeks ago, and then I had to order more. And because of the value, especially if you're on a high dose therapeutic protocol,
Mm.
like you said, you're taking 1,200 milligrams from different sources, and
Mm.
maybe insurance covers some and creams
Well,
don't.
no, it covers nothing in the
It
UK. We're on
doesn't?
our own. No, we're
Oh,
on
you're
our
on your
own.
own? Oh, no.
We get the
Well,
NHS, we get a little bit, but the rest of it has to be done
well,
privately.
it's the same here with a bioidentical cream. It's not
Mm.
covered by insurance
Mm.
either. However, it does, you get a better value with the drops because it's more concentrated and it does absorb. I happen to like it quite a bit. But our creams have been a staple and they're amazing. So you can go on Platt Wellness, and we also have a lot of blogs. So a lot of information you can gather to help you. We have progesterone guidelines that are kind of just a basic guideline. And if you have any questions, you can certainly send us a question to questions@plattwellness.com. And I'm more than happy to
Brilliant.
answer them as well. So
That's
yeah,
amazing, Annette. I mean, I could talk to you for 3 days about all of these things, and I'm sure we will get lots of questions that come in and come back when we start sharing this. But
yes,
for now, thank you so much for your time. I
absolutely.
really appreciate you continuing Dr. Platt's work so it doesn't get lost, because it's so valuable. So thank you so much.
Yes, thank you so much. I appreciate it. It's been lovely meeting you. Take care and be well.